Vanakkam, good morning. In this video, we are going to discuss about the vestibular apparatus. Components of vestibular apparatus are utricle. This is the utricle, saccule, and semicircular canal. This is the endolymphatic sac. Endolymphatic sac. This is the cochlea. Utricle saccule is important for the static equilibrium. The semicircular canal is important for the dynamic equilibrium. The vestibular apparatus is located in the petrous part of the temporal bone. It is located in the petrous part of the temporal bone. There is the bony part and membranous parts. Outer part is the bony parts. The semicircular canal utricle saccule present within the membranous parts. So the membranous part is filled by the endolimb. The bony labyrinth part is filled by the perilimb. Endolimb contains the more amount of the potassium ions, less amount of the sodium ions. So it is similar to the intracellular fluids. Perilimb contains the more amount of the sodium, less amount of the potassium. It is almost similar to the extracellular fluids. Receptor organ for the equilibrium are collectively called the vestibular apparatus. It has the role in the regulation of the posture and equilibrium. It is the sense organ which is stimulated by the gravity and rotation movements, mainly the angular rotation and when we are traveling in the bus or train, lift, and when we are rotating ourselves, these times the vestibular apparatus are stimulated. Vestibular apparatus is present in the inner ear, mainly be the petrous part of the temporal bone. It consists of the three semicircular canal, otolith organs, utricle and saccule. The equilibrium, the maintain the posture balance is called as the equilibrium. There are two types: static equilibrium. We are not moving, but when we are traveling in the bus or train, it is moving linear acceleration. So one direction moving. When we are going through the lift, it is vertical accelerations. So these are the example for the linear accelerations, traveling in the bus, train, and travel through the lift. So maintenance of the position of the body relative to the force of the gravity. The dynamic equilibrium, maintenance of the body position in response to the rotational movements. சின்ன குழந்தைகள்லாம் ரொட்டேட் பண்ணுவாங்க, இந்த கிறுகிறுண்டு சுத்துவாங்க. That time the vestibular apparatus is stimulated to maintain the position of the body by the dynamic equilibrium. Receptor for the static equilibrium are called as the macula. Macula is present in the utricle and saccule. The utricle, the hair cells are arranged in the horizontal positions like this. Horizontal positions. In the saccule, it is arranged in the vertical positions. So macula mainly present in the utricle and saccule. Hair cells are embedded in the endolimb. Endolimb contains the more amount of the potassium ions, less amount of the sodium ions. The hair cells, longest hair cell is called as the kinocilium. Other hair cells are gradually decreases in the lengthwise. These are called as the stereocilia. When the depolarization, stereocilia is bent towards the kinocilium. During the hyperpolarization, the stereocilia is bent away from the kinocilium. That inhibit the stimulation. The macula. Each macula contain supporting cells, scattered receptor called hair cells. So macula only present in the utricle and saccule. So it contains the supporting cells and hair cells. Each hair cell has a major ciliary process. The longest ciliary process is called as the kinocilium, and the smaller ciliary process is called as the stereocilia. Hair cells is tipped in the gelatin-like otolith membrane. The otolith membrane contains the calcium carbonate crystals on their surface. Calcium carbonate crystals on their surface. The base of the hair cells are innervated by a vestibular branch of the eighth cranial nerve, that is vestibulocochlear nerve. The dynamic equilibrium is the maintenance of the body positions are hit in the response to the rotational movements. Rotational movements. This is done by the hair cells present in the semicircular canal. This is done by the hair cells located in the semicircular canal. The three semicircular canals are present at the right angle to one another. The anterior and posterior semicircular canal, anterior and posterior semicircular canal positioned vertically. It is positioned vertically. The lateral semicircular canal present horizontally. The semicircular canal, the membranous part is filled with the endolimb. Bony part is filled by the perilimb. So this receptors, everything is filled by the endolimb. Sensory epithelium present in the semicircular canal is called as the ampulla. This is the structure of the ampulla. Each semicircular canal has a dilated end called the ampulla containing the receptor organ for crista ambularis. This is crista ambularis. Each crista ambularis contains the hair cells and supporting cells. These are covered by the cupula. It is gelatinous material. The mechanism of stimulation of semicircular canal. The angular acceleration of the head, rotational movement of the head. That time the movement of the fluid in the opposite direction, the semicircular canal. If the movement is occur in the towards the right side, means the endolimb moves left side. So pressure on the cupula of the semicircular canal. This is the cupula of the semicircular canal. So the deflection of these cilia, stereocilia to the kinocilium or away from the kinocilium. So depend on the situation. So increase decreases the potassium influx into the hair cells. When the hair cells is moving towards the kinocilium, it increases the firing rate. Moving away from the kinocilium, it decreases the firing rate. This is the mechanism of stimulation of the semicircular canal. The semicircular canal give the information about the rotation movement of the head and activate the appropriate mechanism to maintain the equilibrium, maintain the balance and the posture of the body. Help in the visual fixation during the angular rotation of the head through the vestibulo-ocular reflex. When the vestibular apparatus is stimulated, it passes through the vestibular nerve to the vestibular nuclei. It activates the extraocular muscles that is helpful for the visual fixation, and vestibulospinal reflex that is also during the angular rotations maintain the posture of the body. Reflexes activated by the vestibular apparatus are vestibulo-ocular reflexes and vestibulospinal reflexes. The vestibulo-ocular reflexes from the vestibular apparatus to the vestibular nuclei through vestibulocochlear nerve, from the vestibulocochlear nuclei to the extraocular muscles for helpful to fix the fix the vision to the particular parts during the rotations, angular rotations and linear acceleration. Like that, the vestibular apparatus helpful for maintaining the body posture and equilibrium through the vestibulospinal reflex. Through vestibulospinal tract. Vestibulocochlear reflex stabilizes the gas. Gas means the visual fixation during the fast head movement. Conjugate movement of the eye in opposite direction to that head rotation, also called the vestibular nystagmus. Vestibulospinal reflex send information regarding the gravity and linear acceleration to the body muscles, help to maintain the center of the gravity. Motion sickness is the very common equilibrium disorder in which due to the vestibular sensory input mismatch. It's mainly occur during traveling in the bus, train, ship, and aeroplane. The main symptoms are nausea, dizziness, vomiting, and severe cases it produces a pale appearance. Disorder of the vestibular apparatus produces a nystagmus. Nystagmus is the involuntary to and fro movement of the eye part. When during the rotation movement, it physiologically occurs the nystagmus. In the pathological conditions, the vestibular dysfunction produces the nystagmus. Vertigo means giddiness. It is also produced during the vestibular apparatus dysfunction. The traveling sickness, seasickness due to the stimulation of the vestibular apparatus. Meniere's disease is the disease of the vestibular apparatus produces the Meniere's disease. It produces vertigo, giddiness, tinnitus, the ear sound, abnormal ear sound, and very difficult to hearing. These are the features of the Meniere's disease. Test routinely used for the vestibular dysfunction: caloric test and Fahrenheit test. Fahrenheit test is we have to keep the subject in the chair and bend forward 30-degree angle, and we have to rotate for the 20 seconds, and we will measure the vestibular dysfunction. Caloric test, they will produce us warm water in the air, and they will measure the vestibular dysfunction. Thank you for watching this video. If you like this video, press the like button, share your friends. Those who are not subscribed this channel, please subscribe. These videos briefly discuss the physiology topics. You must read the physiology textbooks. Thank you once again.